All right, so we're going to look at chapter 7 today, getting a little introduction to some thermal agents here. So some of the objectives that we're going to be covering today discuss categories of physical agents and the role of each category in rehab processes, discuss various pain theories and their applications to physical agent interventions, something kind of like what we did in one of our previous lectures where we were looking at the gate theory of pain control. Also going to identify physiological effects of indications for contraindications for physical agents. So we're going to look at that in a little bit more detail when we get into chapter 8, when we start thinking of cryotherapy, thermotherapy, application of hot pack and cold packs. So we'll get in more detail with that in chapter 8. We're also going to identify the effects of physical agents on pain relief functional activities, discuss and implement patient and healthcare provider safety considerations before, during, and after the application of these physical therapy agents. We're also going to look at a few case studies in the lecture, trying to determine when an intervention should not be performed due to clinical indications, when an intervention is beyond the scope of the PTA, and when to report changes in patient status or progress to the supervising physical therapist. If there's anything that happens during your sessions that doesn't seem right, it's not within our scope to make any judgments or change, and we can't change the plan of care, obviously. So if you do see anything like that, we're always going to report back to our supervising PT to get further direction. We're going to demonstrate proper, safe, and effective application of thermotherapy in our lab setting. We're going to talk a little bit about that today as well, and demonstrate competency in proper, safe, and effective application of cryotherapy, something that, again, we're going to do in the lab setting, but we'll talk about how to make these safe choices, how to set up our patients safely, and all of those fun things. So the first thing that we really need to understand is this idea of what specific heat is. So the definition is the amount of energy required to raise the temperature of a unit mass of material by 1 degree Celsius. So basically what we're saying is how much heat a substance can absorb before its temperature changes significantly. Now, materials with high specific heat require more energy to increase the temperature. The opposite for materials with low specific heat. So I always like to give this example to my students, and just imagine that you are sitting at the beach, okay? And you're putting your toes in the sand, it feels really, really good, it's warm, it's hot, right? That sand is very hot. It has a low specific heat. It heats up very quickly. It doesn't take a lot of it doesn't take a lot of energy to heat that material up. But then you go into the water, and the water is still very cool. Water has a high specific heat, which it requires more energy to increase that temperature, right? So the sand is going to be hotter because it has a low specific heat. The water is going to be much cooler because it takes way more energy to heat up that entire ocean, okay? So that's a good example to think about when relating to specific heat. So like I said, water has a high specific heat. Something else that we're going to look at in our lab setting is paraffin wax. So we're going to do some hot pack, cold pack applications. We're going to do ice massage, and then we're going to also play around with this paraffin bath and this paraffin wax. Paraffin has a very low specific heat. So we'll kind of discuss the application of those two a little bit later on, and we'll refer back to the specific heat. Now I do want to talk about some of these other considerations, moist heat versus dry heat. This is something that you'll see in your homework assignments, is kind of the differences between each of these. So let's take a peek. So when we think of moist heat, we're thinking of our hot packs, right? We have those nice clay packs that sit in hot water. We put those in their little sheets, and then we apply those to the patients with the appropriate layering. That's a moist heat. That's a type of moist heat that we're applying to our patients. Generally more effective at transferring heat to tissues. It also typically penetrates deeper into those tissues. It increases blood flow, increases muscle relaxation. Typically, this is more comfortable for your patients as well. Requires careful monitoring due to high energy transfer though. So if we are using moist heat, yes, it's going to be more comfortable for your patients, but you're also going to really have to pay attention to the skin and the changes on the skin because there's a high risk of burning when using this moist heat application. So again, some of the examples at the bottom there: moist heat hot packs, hydrotherapy, even something like a steam bath. So now let's look at dry heat. This is typically less efficient at transferring heat to tissues. It provides more of a superficial heat and has less impact on heating those deep tissues. There's usually less of a risk for burning compared to moist heat because there's more of a gradual transfer of heat to those tissues. And some of the examples that we look at here are electric heating pads, so maybe some of the ones that you use at home, maybe like a blanket as well. Dry saunas and infrared heat lamps would all be examples of dry heat. Then we're going to look at the specific heat of various materials. So we're thinking of all of these different types of tissues that we're targeting with the application of a hot pack or a cold pack. So skin and muscle tissue is the first one that we're going to look at. Typically has a higher specific heat because there's a lot of high water content in these tissues. So what does that mean when we have a higher specific heat? Well, it means that we need more energy to heat those tissues. Then we look at fat or adipose tissue. Typically a lower specific heat than muscle, but higher than bone. So lower specific heat requires less energy to heat that tissue. When we look at bone, it has a low specific heat, low water content, but really susceptible to rapid temperature changes. So when we start talking about therapeutic ultrasound and we're looking at this continuous ultrasound, this is going to be something that we're going to really have to pay attention to, are something like these risks of burning the actual periosteum of the bone. So that's something that we're going to look at when we get a little bit more in depth with our thermal ultrasound material and lecture. As far as tendons and ligaments go, also low specific heat, and they have low water content. So you can kind of see most of them, the different types of tissue that we're looking at, low specific heat, at least in comparison to skin and muscle tissue, which is a higher specific heat. So just remember that high specific heat means that it needs more energy to raise the temperature of that tissue. When we have low specific heat, that means we need less of that energy to transfer heat to those tissues. We're also going to talk about these different modes of heat transfer. So the ones that we're going to look at are conduction, convection, conversion, radiation, and evaporation. All of these can have some benefit to our patients in this therapeutic kind of way. So you look at conduction, this is energy exchanged by direct contact between two materials at different temperatures. Energy transfers from an area of higher temperature to an area of low temperature. So if we think about the application of a hot pack, right, we have direct contact between two different materials, the hot pack layering and our skin. So we have that direct contact. And if you're thinking as well that you're trying to heat the tissue up, right, the hot pack just came out of this hydroculator, which is about 160 degrees, and we're placing it on the skin, so that heat is going to transfer from the hot pack to the skin. So area of high temperature, which is the hot pack, to an area of lower temperature, which would be the skin or the tissue that we're trying to heat. Then we get to, still looking at conduction here, looking at some of these guidelines for heat transfer. The greater the temperature difference, the faster that heat transfer is going to be. Materials with high thermal conductivity transfer heat faster. And when we have a larger area of contact, the greater the total heat transfer is. The rate of temperature rise decreases in proportion to tissue thickness. So we also have to consider the thickness of the tissues that we're heating, and we have to think about that target tissue too. So if you're looking at heating some really deep muscle in, let's say, the hip region, it's going to be a lot harder to get that increase in temperature deep into those tissues because of the thickness. And just remember that with conduction, this is all superficial heating anyways. Okay, so still continuing with conduction here, for safe and effective heat transfer, We have to have high specific heat and moderate thermal conductivity. There's a tolerance to the initial temperature change that we have to think about as well. Some people may be more susceptible or more sensitive to those changes in the temperature initially. We'll always have to remove any type of metal or jewelry. We're not trying to heat up the metal. We're not trying to create burns on the skin. So make sure that if your patient is wearing metal, it's best just to remove all of it or any kind of jewelry from the area to limit that liability of burning the patient. When we think of hot packs and applying a hot pack to a patient, we need at least 6 to 8 layers between the hot pack and the skin. So that's really important. That's going to be something that you'll see on your skill competency in the future. You need 6 to 8 layers, and we need more if we're going to actually lay the patient on top of a hot pack. So it's really common for, let's say like low back pain, for a therapist to place the hot pack on the table or the plinth that they're lying on, and then have the patient lay on that hot pack. If you're going to do that, you need to add more layers. So instead of 6 to 8 layers, you may need 8 to 10 layers for the instance where your patient is actually lying right on top of that hot pack. Then we're going to get into convection here. So what is convection? I have this little image of this convection oven over here. This is where heat transfers by direct contact between a circulating medium with another material of a different temperature. So again, that's why I have this image of this convection oven over here. Transfers more heat than conduction does typically, and we're going to talk about why. And then you may see this in a whirlpool versus just like a regular tub. So if you're sitting, let's say in your bathtub and you're taking a nice bath, typically that water isn't circulating, right? You're just sitting in the water. There's no movement of that water. You may notice that the water surrounding you, let's say if it's in like a cold plunge or something like that, to make this a little bit easier to kind of visualize. So let's say you're getting into a cold tub, not your hot tub or your bath, but you're trying to decrease inflammation or something along those lines. So you get into this cool tub, and initially it's very cold, but you start to feel this kind of like little heat pocket, this warmth surrounding you. When the water is not circulating, we talked about how the heat transfers from areas of high temperature to low temperature. Your body is producing quite a bit of heat there, and you're transferring that heat to the water, right? Area of high temperature, the skin, your body, to an area of lower temperature, which would be a cold plunge or something along those lines. Whenever that water is not circulating, you're going to get this little pocket that surrounds your body, and that water is actually going to be warmer than the water that isn't surrounding your body or isn't in direct contact with you. So when we have this circulating medium, it doesn't really allow for that to happen. If you've ever been in a cold plunge, they may have this little jet at the bottom or something that's circulating the water. That's so you don't really get that little warmth or that pocket of warmth while you're trying to do the cooling at the same time. This is also something that happens in the body naturally via this convection. Circulating blood via vasodilation. So this is kind of what happens in your body anyways whenever we're applying a hot pack or a cold pack. Your body's trying to keep you warm, so it's going to circulate that blood through your body in order to maintain that same tissue temperature or that internal temperature. Now we're looking at conversion, so this is a little bit different here. This is where we convert a non-thermal form of energy into heat. That can be mechanical, electrical, some type of chemical energy. The ones that we're really going to focus on in our lab settings are going to be ultrasound. So that's the one that we're going to look at. But we will talk a little bit about diathermy as well. But basically, if you remember from previous lectures and examples, when we look at something like ultrasound, this is producing sound waves. So this is some type of mechanical energy that is being produced by the ultrasound head. Those sound waves are going to enter into your skin, and then it's going to cause vibration, friction, and that causes heating of those tissues. So the difference between some of these other ones that we looked at earlier, conduction, convection, and conversion, is that specifically to ultrasound, we're going to use this for a little bit more of a deep heating type sensation compared to superficial or something along those lines. The heat transfer definitely depends on the power output. We're going to talk about all the parameters, the intensity to create that heat deep into the tissues. And we always need something like gel, water, or lotion as a medium for those sound waves to travel through. So we'll talk more about why that is so important when we get into our ultrasound lecture and chapter, but we always need some type of medium to kind of help deliver those sound waves into the tissues. Still looking at conversion here, but focusing more on diathermy now. This is when we use electromagnetic waves to penetrate deep into the tissues, where energy is converted into heat by causing molecular vibration and friction in those tissues. So it's similar to what we see with ultrasound. We're still getting that vibration and friction deep within those tissues to create this heating response. But instead of sound waves, we're going to use high frequency radio waves or some type of electromagnetic wave as compared to just sound waves, mechanical sound waves. So when we're looking at indications for conversion type therapy or diathermy in general, pain management is going to be something that we're going to use these modalities for. Muscle relaxation and spasm is something that we can also utilize diathermy and ultrasound for. If we have joint and tissue stiffness, we're going to use these modalities to kind of help relieve your patient's symptoms. And of course, we can use ultrasound for tissue healing and inflammation reduction. So we'll talk about the different forms of ultrasound. We'll discuss diathermy a little bit more as well too, but those are the indications that you're going to typically see for the use of diathermy and this conversion type therapy. The next one that we get into is radiation. So this is transfer of energy in the form of waves still. Does not need intervening medium or any other types of contact. So you can see this here. This has been a really popular modality over the last couple of years and kind of used more so in gym settings, spas, things like that. But this infrared type sauna is something that is popping up all over the place. And the reason that they use it is, again, to try to transfer heat in a more effective way. The rate of temperature change depends on the intensity of the radiation. We're going to see that pretty much across the board here. How intense is this modality? We're not going to look at any parameters for radiation type heating modalities, but the intensity does matter. Relative size of the radiation source in the treatment area is also going to determine that rate of temperature change and the distance and the angle of that radiation. So some of the examples, like I mentioned earlier, infrared heat lamps. So that's kind of what you're seeing here in this image. Infrared saunas are really popular nowadays, but we can also use UV light and cold laser. And I have seen those a little bit more common now so in the clinical setting, especially the cold laser has been used a little bit more, and our students have actually got to experience that out in the setting, in the clinical setting. So those are some types of radiation type therapy that you can use to either increase the temperature of the tissues or maybe even decrease some of that inflammatory processes. And the last one here, something that you all maybe have experienced previously, is this evaporation. So changing a liquid to gas, vapor requires energy absorption. So the image that we're showing you here is what we call a vapocoolant spray. So they're spraying the skin, they're trying to cool down the area, decrease pain right away. Something that is a popular technique is what we call a spray and stretch technique as well. So if somebody's having, significant pain, let's say in that quadricep, like this person here, getting this vapocoolant spray, you can actually spray the skin and then perform stretching techniques right afterwards. It's going to numb the area, it's going to decrease the pain, and then you're going to go ahead and stretch that area to try to increase range of motion. So some of the examples are that vapocoolant spray, and then you can also think of just sweat evaporation during exercise. That's our body's way of staying cool during exercise and kind of regulating our temperature. Okay, so hopefully that was helpful. Definitely need to know the different forms of conversion from heat sources. So think about conduction, think about conversion, think about convection, and all those different forms that we just mentioned, and be able to tie a modality to those. Okay, so think about it in a clinical setting, clinical application. You know, this is the type of heating that we're using, a hot pack, a cold pack, whatever it may be. You want to make sure to be able to tie that into conduction if you're using a hot pack or a cold pack. If you're using ultrasound, you want to make sure that you know that that is a conversion technique of heating. So make sure that you go through those, you study those different forms of heat transfer, and know a modality that you can actually relate to that form of heat transfer. Okay, if you have any questions, please let me know. Again, hopefully this was helpful. Chapter 7, Introduction to Thermal Agents. Thank you.